Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is December 4, 2025. This video is on a Lancet Seminar published online first on November 25, 2025 on chronic kidney disease. What is chronic kidney disease? It's defined as structural or functional kidney abnormalities lasting equal to or greater than 3 months. How common is CKD or chronic kidney disease? It affects about 850 million people globally and is projected to be the 5th leading cause of death by 2050. How is CKD diagnosed? Diagnosis is based on eGFR and urinary albumin to creatinine ratio according to KDIGO criteria. Why is albuminuria important? Albuminuria predicts kidney failure and cardiovascular risk independent of eGFR. What causes CKD? Common causes include diabetes, high blood pressure, glomerular diseases, and inherited disorders. What is eGFR? Its estimated glomerular filtration rate reflects kidney filtration, usually calculated using creatinine. When should cystatin C be used? Cystatin C improves eGFR accuracy, especially in patients with abnormal muscle mass. How is CKD staged? By cause, GFR category G1 to G5, and albuminuria category A1 to A3. Why screen high-risk patients? Older adults, diabetics, hypertensives, and those who have CVD, cardiovascular disease, have increased CKD risk. What is the kidney failure risk equation? A validated tool predicting 2 and 5 year risk of needing kidney replacement therapy. How often should CKD be monitored? At least annually, with more frequent monitoring for advanced stages. Which lifestyle measures help? Smoking cessation, weight loss, physical activity, and sodium restriction. What is the blood pressure target in CKD? Less than 130 by 80 millimeters of mercury, or systolic less than 120 millimeters of mercury, when tolerated with standardized measurement. Do statins benefit CKD? Yes. Statins reduce atherosclerotic cardiovascular disease risk and should be widely used in CKD patients above the age of 50 years. What diet helps CKD? Mediterranean-style diets may reduce cardiovascular risk. Protein ingestion about 0.8 grams per kilo per day is advised, so a little less than 1 gram per day. What medication slows CKD? RAS inhibitors, SGLT2 inhibitors, GLP-1 agonists, and finerenone in diabetic CKD. Why are SGLT2 inhibitors important? They reduce kidney failure by 30% and heart failure hospitalizations by 40%. Should SGLT2 inhibitors be stopped in illness? Yes. Follow sick day rules to reduce AKI risk during dehydration. What is the role of finerenone? It lowers CKD progression and heart failure hospitalization in type 2 diabetes with albuminuria. When is metformin contraindicated? When eGFR is less than 30 mils per minute per 1.73 square meters body surface area due to lactic acidosis risk. How is CKD anemia treated? With iron depletion and erythropoiesis stimulating agents, keeping hemoglobin between 10 to 11.5 grams per deciliter. What is CKD MBD? Mineral bone disorder involving phosphate retention, abnormal calcium, and parathormone elevation. How is metabolic acidosis treated? Oral carbapenem may be used, though optimal thresholds remain uncertain. Is iodinated contrast safe? Modern evidence shows permanent harm is rare. Avoid unnecessary delays in imaging. When to refer to nephrology? When the 5-year kidney failure risk is greater than 3 to 5%, when there is suspected glomerular disease, or with anemia, a hemoglobin less than 10 grams per deciliter. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.